Hello, dear participants. We are pleased to invite you to this webinar. The ISSUP Ukraine invites you to this webinar on the role of public organizations in providing assistance to users of psychoactive substances, specifically focusing on the experience of Ukraine for the last 10 years. ISSUP Ukraine is one of currently 24 national chapters within the ISSUP family. The International Society of Substance Use Professionals, ISSUP, is an international organization that supports the professionalism of the drug demand reduction workforce. Through its website and other virtual activities, events, and the work of its national chapters, ISSUP seeks to promote evidence-based, high-quality, and ethical practice in prevention, treatment, and recovery. It is a membership organization, and you are free to join. And currently, this organization has more than 17,000 members. And we invite all of you to become ISSUP members on our website, www.issup.net. So for further information, please see the website. And today, we will speak about experience of Ukraine and public organization providing care to users of psychoactive substances. And I will introduce the speakers. So we have with us Viktoriya Zhukova, PEPFAR Program Manager, US Peace Corps in Ukraine, and Ella Sokoliuk, Public Health Specialist for HIV/AIDS key population, US Peace Corps in Ukraine. And they will be presenting about cooperation between Peace Corps PEPFAR Ukraine and local NGOs on development of a support system for people who are injecting drugs. Also, we have Dr. Vyacheslav Kushakov, founding member and senior advisor from Alliance for Public Health, who will be presenting the development of services for people who use psychoactive substances in Ukraine. And we have Alla Shut, psychologist, head of charitable foundation Vita Valens, national consultant of Council of Europe, who will be presenting drug awareness in Penal institutions. And also myself will be presenting the technology transfer model in Ukraine. We are pleased that you all joined us for this webinar. At the end of this webinar, we will have questions and answer session. So if you have any questions, please type them into the chat, and these questions will be addressed at the end of the webinar. So let's start the presentation, and I will start my speech and show my screen. If you will see my screen, please tell me that everything is okay. You see my presentation?
Yes, we do.
Okay, thank you very much. So I will be talking about adaptation of technology transfer model to local contexts and its implementation in Ukraine. In Ukraine, we have a high prevalence of alcohol use disorder, drug use disorder, and there has been increasing number of people seeking treatments as the result of use of psychoactive substances. And the number of deaths due to use of psychoactive substances and overdoses increased by 1.5 times over the last 5 years. And 22% of people who inject drugs may live with HIV, and about half will know their HIV positive status. And we have one of the the second largest HIV epidemic in Ukraine among the European countries. And along with this, we have still some restrictions on access to HIV testing and treatment, and relatively low levels of medication assistant treatment. As a background of all of this, we have active military conflict and displacement, which influences the services and access to services. So the HIV ATTC in Ukraine Addiction Transfer Technology Center was established 3 years ago and funded by US President's Emergency Plan for AIDS Relief and SAMHSA. And it was established as a partnership between University of California, San Diego and Institute of Psychiatry of Taras Shevchenko National University of Kyiv. And the main mission of this organization was to assist the government and people of Ukraine to build necessary competencies and capacities of substance use treatment workforce to respond to the HIV epidemic. So among these, the mission was to heighten the awareness, knowledge, and skills of workforce, but also to foster regional and national alliances among practitioners, among stakeholders, and to influence the development of policy in addiction field. So in short words, the ATTC mission was to bridge science and practice using the technology transfer model. We know that effective intervention, in order to be successfully adapted, in order to be successfully used and to bring the good outcomes, need to be effectively and sufficiently implemented. And this gap in implementation usually influence that even effective intervention can be connected with bad outcomes because of ineffective and insufficient implementation. So the technology transfer model is answer to this gap. We have the model of the diffusion of any innovation, and you see it on the screen, and this model has the development stage of any innovation, any idea. Then there is a translation explaining the essential elements of this innovation and packaging it to facilitate dissemination. Then the dissemination process is to promote awareness of an innovation and encouraging adoption and implementation. And dissemination strategies can include raising awareness, building knowledge, and distributing materials. And then implementation, the incorporating the innovation into routine practice and on different levels, individual, organizational, and systemic levels. And it can be skills training, administrative changes, and policy changes. So the technology transfer is not about developing the innovations or developing new practices, but translation of existing evidence-based practices and dissemination information about it, knowledge and skills, and facilitation in adoption of these practices in order to implement them correctly. So when ATTC started its activities, prior to this there was training needs assessment, and according to this training needs assessment, there are 4 main topics were chosen to implement in Ukraine for first years. It's about current knowledge on substance use disorders and existing evidence-based practices, screening and brief intervention strategies for motivational enhancement, and dual disorders. It took a time to establish effective partnerships and to talk about the existing innovations and existing evidence-based practices and to advocate for them. Then the tactical assistance started, and it included the series of trainings, webinars, seminars, as well as followed by further supervisions. And to achieve sustainability, it was a decision to build a cadre of national trainers and system of cascading knowledge and skills on evidence-based practices in HIV, mental health, and substance use disorders. And also it was a decision to adapt the training curriculum to local context and needs, and to build local online platform for education. Here you can see two generations of national trainers who received the education, and here are the data of this. So on the first years, around 1,000 participants, service providers received the education, but then the national trainers education started, and national trainers by themselves conducted 28 more trainings and educated more than 500 specialists. So the cascade system of learning started, and after this training, as well as national trainers are also decisional makers in their organizations. They introduced their knowledge and skills into their new projects and new training activities. So these changes are already sustainable. Training topics that we usually used in our education is current knowledge and skills, syndemics, mental health comorbidities, build motivational enhancement, LGBT and substance use disorders in use, medication-assisted treatment, amphetamine-type substances, and contingency management. And for achieving sustainability, also several training courses were adapted and were now available within National University of Kyiv, and they are already independent from HDC funding, and they are available within the university for all Ukrainian specialists who can apply for them, and they can be paid by specialists themselves, or they can be paid from organizations that refer specialists to these courses. Also, there was an online platform for online education developed, and for now it has recordings of different webinars, as well as online trainings are performed on this platform, but also it is planned to have fully online past courses for this platform. And also there were several publications. This is one example of it, about ATTC activities. So after 3 years of functioning, we have already 30 certified national trainers, 12 more candidates. We have universal treatment curriculum models translated into Ukrainian, and first modules of basic course were disseminated between interested universities. We have developed online platform. We have 3 UTC-based courses on postgraduate education within National University, and also we have curriculum changes for medical students based on UTC, and we have translated course on substance use disorders in veterans from University of California, San Diego, which will be soon available on our online platform. So UCATC strengthened its reputation and showed itself as valued partner in intensifying efforts to control the HIV epidemic in Ukraine and to reduce the burden of interrelated and growing epidemics of substance use disorder and HIV. And now ATTC is transformed to ITTC, an International Technology Transfer Center, which has even more broader scope of work, and which is not so strongly connected with HIV epidemic, but mostly focusing on substance use prevention, treatment, and recovery support services. So this is my presentation. Thank you all for listening. Here is my email. If you have any questions, I will be happy to answer. Of course, if you can type your questions into the chat. And now I'm passing the floor to Viktoriya Zhukova and to Ella Sokoliuk.
Hi. I'm Viktoriya Zhukova. I'm Peace Corps PEPFAR Program Manager, and I'm going to present today with my colleague Ella Sokoliuk. She's Key Population Specialist as related to HIV epidemic in Peace Corps Ukraine. And just to start, while Ella is presenting and opening the presentation, what I'm going to say is that Peace Corps is a US government institution, and we have US volunteers coming to Ukraine and working in non-governmental organizations. Specifically in our program, it's organizations working with HIV services. Also, the volunteers are working with youth, and they are working at schools teaching English. And PEPFAR, for those of you who might not have that much touch with PEPFAR, is the President's Emergency Plan for AIDS Relief. And it's basically the biggest state initiative to combat HIV throughout the world. And while Ella is still opening the presentation, next slide.
I'm sorry.
So basically, just to give you an idea how we work, we have partner organizations here working with PEPFAR, and that's USAID, CDC, Department of Defense, and we also had SAMHSA as a partner. So basically, our volunteers work in local communities together with their NGO, HIV service NGO partners on projects to support HIV positive people and key populations, which are in Ukraine, people who inject drugs, men who have sex with men, commercial sex workers, and also children and youth living with HIV in Ukraine. And we work on the volunteers in their local communities, work on projects to basically support people affected by HIV and key populations. And today we are going to talk with Ella to you about these initiatives. So we are small-scale project development, and the best practices that we encounter, we share with our big partners, USAID and CDC. Next slide. So here you can see our achievements in the past year, and I'm going to give you a couple of seconds to take a look at those achievements. As you see, we have quite a big outreach on the local communities supporting HIV-affected populations, key populations, and youth living with HIV in Ukraine. Next slide. Again, as I said, the comparative advantage of our volunteers is that they are actually living with local communities for a year or 2 years, and together in partnership with local partners, they're working on different projects to support key populations, people who inject drugs among them. And today I'm going to talk with Ella to you about the hands-on projects and experience in the field, which we are doing together with volunteers and their local partners to support people who inject drugs related to them being affected by HIV. And I'm going to talk to you today about minivan testing. Ella is going to talk to you about community-based testing. Then I'll come back to discuss a little bit about training for medical professionals in the local communities, especially to combat stigma and discrimination, to teach them screening, motivational interviewing, index testing, and support children affected by HIV and living by HIV, having people who inject drugs as their parents, and sometimes, quite often times, being orphaned by AIDS. Next slide. So this is one of the most favorite volunteers projects which Ella started together with the Alliance for Public Health in 2019. That's when and I believe our partner and colleague will present today more about this project. But basically, in a nutshell, that's the project in which the minivans were coming to the places close to people who inject drugs, like so-called street outreach. And the volunteers were people who inject drugs were waiting to get tested for HIV. The volunteers were talking to them on the streets and exchanging experience of HIV epidemic in the US, what type of treatment is available there, the importance of treatment, the importance of testing, the methadone programs, how they were functioning in the US. Basically, that was functioning in several big cities in Ukraine, and our volunteers were on board in these minivans together with the local professionals doing the testing and consultations for people who inject drugs. Next slide. Now Ella is going to talk to you a little bit about our community-based testing projects by volunteers.
Hi. Peace Corps volunteers with Ukrainian partners NGO understood that key populations, especially people who inject drugs, don't test due to lack of trust to medical facilities. They decide to make a project and create a testing cabinet in their NGO with social worker providing. The expectation was that such a safe space will increase testing and HIV positive case finding. Here on this slide, you can see the cabinet creation. As you can see the result in the first half a year. Testing and HIV positive case finding among key populations increased 3 times compared to medical facilities average. So the volunteers did this project into more by big city in Ukraine. Oh, I am sorry. Next slide. Okay, thank you.
So not only were the volunteers creating safe spaces for testing and consultations in the local NGOs, which proved to be very efficient and increased the HIV positive case finding almost 3 times more than in medical facilities, the volunteers also understood the importance of working with medical professionals, providers of such HIV services, and also linking people affected by HIV, specifically people who inject drugs, to testing. And we know that one of the core barriers for testing and treatment and linkages and referrals to HIV services was stigma and discrimination in local communities, including among medical professionals. So what the volunteers together with their NGOs did, they worked together with medical professionals, training them in anti-stigma and discrimination techniques, on the correct language to use while working with affected populations, people who inject drugs specifically. They provided them with the knowledge of screening and motivational interview on index testing for people who inject drugs. And here on the photos, you can see these community-based trainings held by, on the right photo, you can see Ella teaching the medical professionals. On the left, you can see volunteers working together with the medical professionals on these topics. Next slide. What also is the upcoming plan of ours is that together with the IATTC, we are planning to do a training for medical professionals and NGOs on people who inject drugs and HIV testing, MI treatment and support. That is upcoming this spring. And on the photo, you can also see the cooperation between the volunteers from the US who are holding these certificates and the representatives of IATTC. Next slide. So we are going a little bit beyond supporting only people who inject drugs to also extend our help and support to children of these key populations, people who inject drugs specifically. Especially during the COVID times, what we learned is that the children of these people who inject drugs, who are also quite often orphaned by AIDS, are in great need of food supplies, because families are facing double burden of both COVID epidemic, but also financial needs and financial burden as related to it. And given that these children are HIV positive and are in treatment, having food supplies is essential for them to stay adherent to treatment and keep on taking the medicines. So we started the project with 76 children receiving food vouchers for almost half a year to support their adherence. And while they were coming for medical checkups to pediatricians, the social workers were distributing these food vouchers and checking on the children's adherence, doing the case management calls to the children and to the families, making sure that the children are on antiretrovirals and have food on their tables to eat and keep on taking the pills. And as you see here, we started receiving quite a number of letters from the families, and also the little cute pictures from the children as the thank you note for this project. Again, as I said, a number of these children are children of people who inject drugs, and a majority of them are orphaned by AIDS, living with their grandparents. And here on the slide, you can see a quotation from pediatrician. We worked in 10 different cities, supporting in Oblast, supporting the children. And the pediatrician submitted this is a very important initiative under the COVID realities. And the caregiver, you can see a quote from a caregiver: "Thank you so much for helping our families and the children who are orphaned by AIDS and providing them with the necessary support." Next slide. So thank you very much again. We've shared with you what we've been doing together with our volunteers and local partners in terms of supporting people who inject drugs and also supporting their children during these hardships. Thank you very much.
Thank you, Viktoriya and Ella, for such a comprehensive speech about your organization. It was very interesting to see your experience and very inspiring to see many directions of your organizations to help people who have problems with substances. So thank you very much for sharing your experience with us. And now I'm passing the floor to Dr. Vyacheslav Kushakov, founding member and senior advisor of Alliance of Health.
Okay, is it working?
Yes.
Yes.
Okay, hello, thank you very much. So, dear colleagues, good morning. I would like to talk about the menu of services available for people who use drugs in Ukraine in historical perspective. And although the menu of services in Ukraine appears to be quite broad, there are significant gaps. And the gaps also relate to the constantly changing drug scene that we will have to respond to. And I will explain what I mean during the presentation. So I roughly divided the history of introduction of services for substance users into several periods, and I will go through each of them in my presentation. Well, essentially, the modern services for people who use drugs started with needle and syringe programs in late 90s. And essentially, Ukraine was quite lucky to introduce the services in the 90s. And the classic community outreach and needle and syringe programs relatively quickly expanded to reaching 200,000 people around 2010. So between 2010 and 2020, the programs managed by the Alliance for Public Health were reaching about 200,000 people. Last year, the programs actually provided services to 243,000 people who use drugs. And those are mostly, essentially, those are people who use drugs by injecting, most of them opiate users. In late 90s, we also introduced Cyrex, which was the first client registration and service delivery monitoring software. And it's very important because over all these years, we collected quite a lot of data on the clients, on their socio-demographic characteristics, on their behavior patterns, and also disease progression, etc., etc. So we accumulated all this data, and it's more than 20 years of data that is available for analysis. And essentially, we utilize the data to adjust the services. And apart from that, the available data also includes integrated biobehavioral studies and also qualitative studies of the drug scene and qualitative studies of patterns of drug use in Ukraine. It should be noted that the history of syringe and needle exchange programs and essentially harm reduction services in Ukraine was always balancing between the scale and the quality on this, or the scale and the menu of the services. And we cannot afford much luxury in terms of expanding this menu. Now with the transition of the services to the government, the menu of services funded by the government is quite modest. It includes syringes, condoms, lube, HIV testing information, and TB screening questionnaire. So all the rest of the services that address complex needs of people who use drugs need to be funded by external sources. So we are able to bridge these gaps with support from PEPFAR, with support from the Global Fund, and from other donors as well. But the introduction of initial needle programs was very important for the development of all the other services. It actually established the initial contact with the communities of people who use drugs, allowed for the development of drug users activism and participation of people who use drugs in the development of services. The services are funded by HIV funding mainly, so the harm reduction programs were introduced with harm reduction funding, but then picked up by the HIV funding, and essentially the outcomes are measured in terms of the influence on HIV infection. And this slide shows the association between the coverage of needle and syringe programs and the prevalence of HIV infection among people younger than 25, which is considered a proxy indicator for the incidence of HIV infection in this population. I mentioned already the challenges related to the change in drug scene, and this slide presents the results of IBBS data in historical perspective, where one trend that is very important, which we can see, is the displacement of the traditional liquid homemade stimulants by the synthetic catenols. And it's very important for harm reduction, and I will also touch upon some of these issues later in the presentation. So essentially the traditional methamphetamine, for example, in Ukraine, Wind, it was designed for injecting. I mean, it wasn't possible to use it in any other ways. So the issue of transition to injecting was not on the agenda. Now with synthetic catenols, essentially it's possible to use them by sniffing, it's possible to use them by smoking. So people may start through non-injecting use, and then there is a high risk of transition to injecting, particularly if there is interaction between the social networks of injectors and people who use drugs by non-injecting means. So this is a new challenge on the agenda. Now I'm going to shift to opioid agonist treatment programs. The program started in about 2004 with some small buprenorphine pilots, and then shifted to methadone for economic reasons in 2008, and it was associated with the Global Fund program. The proper expansion of this service actually started as an aid to antiretroviral treatment, and it was funded by HIV money, and this is the situation now, so it continues to be funded by HIV funding. We also introduced liquid methadone in 2015, and in 2017 we started transferring the opioid agonist treatment program to the government. The transfer started with the government procuring the medicine, and now actually the government is supporting not all the medical side of the services, but there is remaining psychosocial support side that is still up to external funders to support. We did significantly increase the scale of the service, but it still remains limited, and there are some challenges to further scale up of opioid agonist treatment, and these relate to high threshold of some of the services, quite burdensome regulations, poor marketing in the communities, and also poor quality of substitutes. So in terms of the figures, in Ukraine we have estimated 278,000 users of opioids, and 15,000 are on opioid agonist treatment currently. Although the expansion of OAT was associated strongly with HIV infection, only just about this 1/3 of OAT patients are HIV positive. And you can see also some of the other statistics related to this program. I guess the presentation will be shared, so those who are interested can actually refer to it later. This slide shows the current tasks of OAT development, and again, you can consult this slide later if you are interested in this particular subject. Since about 2010, the spectrum of intervention significantly expanded with some of the innovations listed on this slide. And one important innovation related to outreach was PDI, or P-driven intervention, which I want to explain a little bit more. So if we utilize conventional outreach in the community, so essentially we identify so-called hotspot or places, geographic locations or site where people that interest us are normally located, and when we go from one hotspot to another and reach some people that are associated with these hotspots. So PDI essentially introduced the chain referral system. So we actually ask people in these hotspots to help us find people in other spots that are not associated with this particular location or site. So we significantly increase the number of people that are reached out, and the chain outreach goes in waves, so essentially it expands exponentially. It was a very important addition to the Ukrainian services for people who inject drugs, because we were actually able to transcend the actual site locations, and the reach of the programs expanded quite significantly. So in about the same period, we also started looking at treatment for hepatitis, and I will not go into detail of this, but now we have a functioning program for HCV treatment, and about 6,000 patients have been already treated through the programs supported by the Alliance. 90% of them are people who inject drugs and their partners. And the treatment is quite successful. It's direct-acting antivirals, and it's working quite well, with 98% treatment success rate among people who inject drugs, and 99.5% retention on treatment. Important area of development was the development of community of people who use drugs, and we know that community activism and peer involvement are essential for the development, implementation, monitoring, and advocacy. And in Ukraine, I would like to highlight several important developments, such as the creation of the national network of people who use drugs in 2017. It's called Volna, and is currently represented in 22 regions, with 3 more in the pipe. And the spectrum of activities is quite diverse, from legal cases, like, for example, in 2019, the network handled 140 legal cases and provided 700 legal counseling sessions. 13 of the cases were referred to Ukrainian Helsinki Human Rights Union. And well, the network also involves in other areas, particularly related to the improvement of service quality. And one example is the analysis of OAT medicines, whereby a poor quality medicine from one of the Ukrainian producers was actually identified. In 2018, the activists from the community of people who use drugs also created a network of women who use drugs, VONA, and it's now active in 15 regions of the country. The network's also quite instrumental in the functioning of the national hotlines that promote particular services for people who use drugs, and in particular this relates to the national hotline on drug dependency and OAT, which functions since 2009, and also national hotline on viral hepatitis. So this is the picture of activists from VONA, from the Women's Network. Since about 2015, we entered the era of advanced HIV detection. So in addition to testing the clients of harm reduction programs in the community, we introduced optimized case finding, and optimized case finding is a model similar to the PDI model. It also uses social networking of people who inject drugs. And essentially the difference is that it explores extended risk networks, meaning that not only direct partners injecting or sexual partners are engaged in the program, but also people who are subjected to the same risk factors as the initial respondents. So the optimized case finding allowed to significantly increase the yield of HIV testing services, and we are talking about 5 to 8 times increase if compared to conventional outreach HIV testing. So we managed to achieve 10–17% of yield of HIV testing by the use of the OCF model, which is also linked to the facilitation of treatment initiation as well. Well, some of the things I'm going to skip because I think I'm running a little bit out of time. So this relates to another system for client registration and monitoring, which is now cloud-based, and it's called OCFA. And also this slide illustrates the application of modern machine learning technology in order to identify the characteristics of the clients that are more associated with HIV infection, so that we can actually target OCFA better by setting the tasks for the outreach workers and people involved in this program. Another important outreach modality is the use of mobile units, and we've been developing it for quite a long time, and now we have quite a few users of this. The latest probably is the use of mobile teams, so-called rapid deployment team, in order to expand the geographic coverage of HIV detection services. Essentially, what this means is that we send the teams of people that include medical workers as well as social workers and peers to small towns and to locations that are outside of the major oblast capitals and are not covered by the current HIV detection services. So the team spends several weeks in a new location and explore the social networks there and apply all the technologies that we apply in oblast centers, but from the mobile base. And it's proven quite successful. This is something that we are going to develop. You may notice that I refer to outreach technologies quite a lot, and I think because this is important for any service that we talk about in relation to people who inject drugs or people who use drugs, whether it be substance use disorder services, mental health services, harm reduction, needle syringe programs, opioid substitution, or any other service. Indeed, it's very important to get into the community, to reach people, and that's why all these technologies will be somehow modified for further development of substance use disorder services if we are to properly expand them. This slide lists some of the more recent innovations, and these are safe injection facilities. We now have one functioning, and the couple are about to be launched. the drug checking service, and I will say a couple of words about this. And also importantly, digital outreach, counseling and delivery of commodities. I will now show another type of mobile unit which we use for working with recreational substance users associated with nightlife venues, with electronic dance music festivals and clubs. So this is the mini van that we use for that, and these are pictures representing our work at the festivals. So the spectrum of services is relatively broad, but the most important element is the use of rapid tests for drug checking. Those are colorimetric reagent tests that we distribute to our clients for them to use it at their convenience, because we cannot collect the samples of psychoactive substances for our own testing at the time, but we are working on a pilot project with the Ministry of Health to be able to do this. So this is an example of the use of colorimetric tests, and these are the addresses of our project drugstore that is working with recreational drug users, but also we manage a digital platform that reaches out to experimenting young people, as we call them, so people who experiment with psychoactive substances, people who explore the sexual life, and we do provide them with information and services related to substance use, harm reduction, and sexual and reproductive health. This is the last slide. I'd like to highlight another outreach model that is fresh, new, that we introduced several months ago. We are linking outreach efforts to online studies, to online surveys, whereby we ask questions that help us to establish eligibility of respondents to receive certain services. And the first such survey was the drugstore chemsex study. It was a study of substance use in sexual contexts, so-called party and play in the US or chemsex in Europe, whereby we were asking a large range of questions about behaviors and risks related to substance use and sexual practices. And through this survey, we actually managed to engage 150 first clients for the first harm reduction program for people who engage in chemsex. And we distribute so-called party boxes, and on the slide you can see the contents of the party box. There are some harm reduction tools for sniffing, condoms, and the colorimetric reagent tests. And we also include, depending on the need, we include rapid oral tests for HIV infection. We can include tests for hepatitis and other things. In the future, we hope to be able to also include PrEP on demand in this package, and maybe some other things that could be useful for people who inject drugs or people who use drugs, sorry. So I would like to conclude by again highlighting that there is a large group of people in Ukraine that require the fairly broad spectrum of different services related to their substance use. And if it comes to substance use disorder services, we are somewhere in the middle of the way, maybe closer towards the beginning in terms of the development of these things. We don't have really much developed apart from opioid substitution, maintenance, and maybe CBT. So we need to engage more, and there is a group of professionals, as my colleagues highlighted, very interested in the development of these programs, and there is a really large group of people in the community waiting for the services to be developed. Thank you very much.
Thank you, Vyacheslav, for this report and for highlighting background and current problems. It was very important for understanding of the scope of activities, and thank you for highlighting the various programs and all multi-dimensional interventions that you did, as well as innovations that you proposed, and for highlighting the extensive partnership building, which was important for bringing changes into the current practice. So thank you very much for your presentation.
Thank you.
And I'm passing the floor to Alla Shut, psychologist, head of charitable foundation Vita Valens and national consultant of Council of Europe.
Thank you. Yeah, thanks for introduction. It's a great honor for me to be in this webinar, and would like to say thanks to Sviatoslav because it's very interesting to hear your presentations being in the National Conference on Drug Prevention. And I'm a last speaker, and now I understand why I am a last, because I'm going to talk about prison. I'm going to talk about my work in the Penal institution, what we have already done. Everything is working okay? Do you see my presentation?
Yes,
thank you. And what we are doing now. By the way, how many listeners have ever been to prison? Could you please send any reactions, raise your hands, or something else? I mean, to being in prison due to your work or maybe study visit, not being convinced of being arrested. Because on the one hand, prison sounds threatening, and really no one would like to be behind the bars, even if we're talking about prison staff. In our country, most of prison staff said, oh, it's my dream, but now I am here. On the other hand, due to my work experience, prison population, as for me, it's a very thankful audience, maybe because they have lack of attention in their own lives. Anyway, for those who have never been in prison, welcome to prison. I started my activity 10 years ago, in the time when prison administration denied existence of any drug consumptions among detainees. And in 2011, Pompidou Group, Council of Europe, implemented an international seminar in Zaporozhye region for the prison, for the medical prison staff, for the whole medical prison staff of this region. 4 days of intensive work by experts from the Netherlands, Slovenia, Moldova, Georgia, did nothing about changing attitude towards drug addicted from prison administration and prison staff. Unfortunately, they stuck their own opinion and intolerance attitude to this category of prison population, but it was the first sowing of the seeds of knowledge and understanding. From 2011 till 2018, numerous trainings and seminars were implemented in juvenile correctional institutions within Pompidou Group Council of Europe projects. Together with Dutch experts, we provided Ukrainian prison staff with European instruments and tools, methodologies, how to work with juvenile detainees, and how to prevent psychoactive substances use. It was implemented and obtained 15 new methods, and among them was very interesting methodology, family conference, that was presented at the international conference in Moldova, in Georgia, and in Serbia as the best practice of Ukraine. I'd like to show you right now a small video how it works in the correctional institution, and our technical fairy Olivia will help us.
Семейные конференции – новая практика для Украины, которая успешно себя показывает уже более года. Они стали особенным событием в жизни воспитанниц. В ходе такого мероприятия определяются пути решения проблемных ситуаций, которые могут возникнуть после освобождения из мест лишения свободы. Ее основной принцип – ребенок сам выбирает людей, которых он хотел бы видеть за круглым столом с целью налаживания общения. Как только ребенок выражает такое желание, персонал старается организовать мероприятие. Иногда это очень непросто.
Все обиды я хочу, те, которые у меня накапливались в это время, я хочу рассказать маме и выговориться, чтобы мы потом забыли это, чтобы у нас началась новая жизнь. Просто семейная конференция для меня это очень важно. Я когда услышала, я очень-очень сильно захотела.
Кате 16 лет. Она любит танцы, поет, рисует, вышивает, мечтает о том, чтобы поступить в институт и стать учителем математики. Сегодня впервые за 8 месяцев к ней приехала мать и тетя, и в ходе конференции участникам удается договориться о том, как улучшить свои взаимоотношения, кто и какую ответственность возьмет на себя.
Маму я не видела очень долгое время, и сейчас вот много обид, которые были раньше, да, то, что меня волновало, я это высказала, рассказала, и мне очень стало легко, то, что и мама, она очень позитивно на это все отреагировала, и все, что прошло хорошо очень, мне аж легче, как камень с души упал.
Мероприятие модерирует специалист, который направляет дискуссию. Ребенок получает поддержку и помощь до мероприятия и в ходе него. После встречи всех троих оставляют поговорить между собой. Стороны диалога оговаривают свою ответственность, планы на будущее. Специалисты считают, что теперь главное – это поддержка Кати со стороны близких уже после того, как она отбудет свой срок.
На сегодняшнюю секунду, когда я на нее смотрю, вот она пишет план, она уже все, она уже успокоилась, она в рабочем состоянии, ей интересно, она заинтересована, она верит в то, что взаимоотношения в семье изменятся.
Хочется верить, что то, что они написали, вот тот план действий совместных, какой они придумали, что он действительно будет осуществлен и он будет работать. Очень хочется в это верить.
Как покажи?
Покажи, как это, мы не знаем.
Мы нашли общий язык с ней, что мы теперь понимаем друг друга, как нам относиться друг к другу, что говорить, о чем разговаривать, что у нас есть общие темы.
This video was done in the Melitopol Correctional Institution for Girls. And we know that one of the key issues of drug prevention or treatment is having at least one prosocial adult as a protective factor. Therefore, renovation of family ties is very important for any person, even being free.
Семейные конференции.
3 years ago, together with experts from Great Britain, we developed and adjusted 12 topics on social skills social skills courses for detainees. It was in the frames of Council of Europe project Future Support of Penitentiary System in Ukraine. The main aim of this course was prepare detainees for release and reduce recidivism. The course was adjusted among 13 pilot prisons with trainings for prison staff and for detainees. And the proposed topics were necessary to find and keep a job, solve family tensions, cope with conflicts, control emotions and anger, develop simple leisure activities, give up using psychoactive substances. And of course, adaptation skills plus awareness about healthy lifestyles as well as coping strategies will help detainees in their resocialization and support them even in give up their psychoactive use. Last year, from March till December, together with Aid Foundation East and West, under the request of Minister of Justice, we did a study on mental health and psychoactive substances abuse among adolescents in pretrial detentions and correctional institutions. This study was done by local researchers under the Dutch expert supervision, using such instruments like CDQ. It's a tool for screening strengths and difficulties of minors, CDQ for professionals working with minors, and MACI. MACI is a short behavioral tool for screening mental health problems and psychoactive use, designed especially for juvenile justice programs and institutions. And we added 5 additional questions concerning alcohol abuse and drug misuse. We even obtained a positive conclusion on the complaints of the protocol and research tools of the study, with the requirements from the Commission of Professional Ethics of the Sociological Association in Ukraine. A lot of efforts was put in order to prepare implementation of this study online due to the COVID period. And according to these results, it was obviously to see the high percentage of behavioral problem and problem among peers that was indicated both by detainees and professionals. Next slide, we can see a diagram with experience of alcohol use and drug use. We can see that 10% percentages of detainees. By the way, I forgot to say that we covered 142 detainees out of 220, and 32 detainees was not able to reach. So we helped them even to read the text. It was done via Google form. Yeah, and among them, 10% never used alcohol, 25 used, and 65 have problematic use. If we can see to the experience of drug use, we can see that less than half of these detainees have never used, but who knows, it was online. Maybe if it will be not online but offline, maybe the percentage will be high, because we know from the governance of the juvenile correctional institutions that more than 80% of crimes were done under the drug or alcohol influence. But anyway, 23% have already used, and 33% have problematic use. And due to this study, Foundation volunteer developed a model, a simple model for prison staff who are working in the juvenile institution in order to raise awareness what drug addiction is, and some instruments including motivational interviewing and CBT, how to help in order, if someone have some problems, how to help them to give up psychoactive substances use. And now this guideline is adjusted on the spot. An important step forward was done by Ukrainian by launching opioid agonist therapy. in its penitentiary institution in 2019. Sviatoslav said that in 2004 it was in the civil sector, and after 15 years it's launched in penal institutions. The Pompidou Group has supported this reform by training prison staff on comprehensive drug treatment provision in prisons. Moreover, it funded renovation of a methadone dispensary with a pretrial detention center in Lviv in the western region of Ukraine. You can see in the picture how this room was before renovation and how this room look right now. And in the last picture, you can see the study. The study training from the person who is from the other prison where this opioid agonist treatment have already started. She shows how to work with liquid, how to work with methadone. In February 2021, Pompidou Group, it was everything in the frame of this project, I mean renovation of this methadone dispenser and the training of 17 psychiatrists, nurses, security office. It was a hybrid training for above mentioned prison staff who are working in the Lviv pretrial detention. The training covered such relevant topics as concepts of substance use disorders, treatment and harm reduction interventions, international prison health standards, medications used in opioid agonist treatment, and throughout care and the role of civil society. The training were led by the experts from Austria, Germany, Norway, the USA, Israel, and Moldova. And after 3 days of group work, master classes, and intensive discussions, the participants developed a practical roadmap for implementing opioid agonist treatment in the pretrial detention facility and improved their knowledge on treating drug addiction. Now I can say that some part of prison staff have a clear understanding what drug addiction is and what harm reduction programs mean. I say some part, not most, because in the frame of the next project, which I'm going to talk about within the UA and Council of Europe working together to support the prison reform in Ukraine, with involving Dutch experts. Now we're working on developing a simple modules on drug awareness for prison line officers who are the ES and IS in the whole prison environment. It should be obligatory to know what drug addiction is, how do drugs affect brain, why drug addiction is called a disease, how to recognize signs of addiction, withdrawal, or overdose, what to do in case of an overdose or of drugs or medication. I hope that this knowledge and this information will be like an entry ticket for working in the penal system. That's all, and in general it was a great experience for me to be involved in all those projects as well as learning international experience and contributing to the penitentiary system. Thank you very much for your attention, and goodbye prison, because I'm a last speaker. If you have any questions, don't hesitate to ask us, and we are open to any questions. It would be better if you address it for the speaker. If I can see the chat, it will be better. Sorry for...
I have sent an email with some questions, if you can access your email.
Email? Okay, just a second. I don't know how to stop showing my screen. Olivia, could you please help me?
That's okay. I've stopped your screen sharing for you.
Okay, thank you, because I see nothing. And Olivia, I see. For Victoria and Ella, the first questions, dear lady, I hope you hear me. How is the reception of service users when you offer the test them from their comfort zone, which are streets? How is the reception of the service users when you are offered the test from them from their comfort zone, which are streets? Do you understand me? Victoria, Elena, do you hear me? You are muted, it seems to me, Victoria. I don't know, I don't hear you.
Maybe just turn your mic off and on again. We'll try again. No. Maybe just check in the control panel in audio. Check which microphone you have selected. No.
Maybe Ella will help you. Maybe she has access to the microphone.
Can you hear me now?
Yes, yes. Perfect. Can
you
repeat the question?
Technology these days. Yeah, I was just saying that maybe my colleague from Public Health from the Alliance for Public Health will help me with that. But basically, I will not dare to go that much into detail because it's their project, but from what we heard from the volunteers, it's very well received. And in terms of so there is the whole tactics of how these people are invited for testing on the street, on how the social workers set up this specific time and place to when these people are coming. And basically the testing itself is very well received. And we've been with our volunteers to one of such events in Kyiv. Basically, the people are quite open to getting tested when they know it's only known by people who come to get tested. That's specifically for people who inject drugs. And the social workers and the volunteers are very open and very friendly as related to talking to them. People usually appreciate a lot, and that's the social part of engaging these people to testing, because basically the volunteers are very friendly in talking to them, and while they are in the line to sharing their experience. And basically, I think this human part of the medical problem is making it easier for people and making them more eager and available for testing, if I understood your question correctly.
Thank you, Victoria. I have one more question to you. Can you please tell me how I volunteering with your country?
How to volunteer with my country?
Yeah.
So if this is the program specifically for US citizens, so if you are a US citizen, you basically look for Peace Corps, and there is the whole application procedures in which you can apply and choose Ukraine as the country of preference. And if you would want to work specifically with PEPFAR, you would choose to be a response volunteer, which means that you have some experience working in HIV-related field or field related to working with key populations, and you start the application process from the US. And then once you're admitted, you come to us, you go through the orientation, we place you in the NGO here in Ukraine, Basically, we support you through your service with your partner in NGO.
Thank you so much. Next question to Slava. Slava, I hope you are with us. Hi. The question, hello, I wanted to know if you have information about services situation of PWID in the areas under military conflict, not under the government control in the eastern Ukraine.
Yeah, well, it's a difficult question. I cannot answer specifically. We did continue offering services in those areas, but it's very, very difficult. Well, the important thing is that after the occupation, the services, the opioid agonist treatment services discontinued because it's banned in the Russian Federation. So some of the clients escaped from those regions to governmentally controlled areas and joined the programs there, but many clients had to actually discontinue and, well, to suffer withdrawal symptoms and stuff like that. The non-governmental organizations that run most of the harm reduction services in those areas are facing other restrictions. So they do provide services, but to a very limited extent. And it's also impossible for the government of Ukraine to fund services on those territories at the moment. So with the transition to the governmental funding, it's virtually it's becoming impossible. So we need to again rely on external funding to support non-governmental organizations there. Thank you.
Thank you, Slava. One more question for you. How much you could change the situation after successful motivational interview?
Well, it's a very important instrument. I highlighted that, for example, one obstacle to opioid agonist treatment scale up in Ukraine is lack of, poor marketing in the communities. And recent IBBS study, for example, found that in the community of people who inject opioids, maybe only half know what it means to be treated this way, what it means, the opioid agonist treatment. So we need a lot of work to actually market the services in the community and convince people to uptake the service and also counteract the various myths that are common in the community with regards to methadone. So there are biases and there are misperceptions about the treatment and what it does to people, etc., and about the medications. And these myths are actually spread quite effectively through the social networks of people who use drugs. And so we need to engage more in marketing, and we need to work more in terms of strengthening the motivation of people. So we need to raise awareness of the treatment modality as such, but also to increase the motivation. And motivational interviewing, we also use recently with support from the University of San Diego. We use motivational interviewing to strengthen the motivation for HIV testing among our clients, which also positively affects the uptake of HIV testing services. Thank you.
Thank you, Slava, for your response. And I don't receive any questions. So if you have any...
Sorry to interrupt. There is one question that came for you, Ala. How do you deal or help drug users after being in rehabilitation centers?
You see, in our countries, thank you for this question, is a real problem because only now we have such a kind of service like probation that is now going to work on to be this link after the person released from prison to support them in the rehabilitation center. So that now we have done only few steps in this case, because before this we have no information how to support these people. Maybe only non-governmental organizations who are working very close with the Penal institution, they provide and accompany these people. We have a lot of this, but we don't cover all prisoners, if I answer your question. But we are working on, and we are open to the international experience, so that I'm like a freelancer who is working with Council of Europe. I'm very open to this experience and with this support and with this knowledge in order to implement this on the spot. Thank you. Do we have any other questions, Olivia?
I don't think so.
Okay, thank you very much for your support. You are our technical fairy that help us to have this session smoothly. And thank you for audience for being with us. It's very important for us to share our experience. If you have any questions, for instance, don't hesitate to mail for us, and we will we'll appreciate receiving these emails with the questions to whom it concerns, I mean the speakers, and as soon as possible we will give you a quick response. Thank you for my colleagues, Ukrainian specialists, and goodbye prison, goodbye Ukraine for today. Have a nice day, and maybe see you soon. Bye bye. Thank you.
Thank you very much.